Hi everyone, we've got a new GP service here at the clinic and we thought we'd take a moment to introduce you to everybody. So I think first you just tell everybody who you are, a little bit about you and your background.
Great, so hi everyone, I'm Dr Kalia, I'm a local GP, local NHS and private GP based in the White Hart Clinic. I am locally trained, know the area really well, and I've been working as a GP for the past 4 years and got quite an extensive background and training in lots of different types of medicine, including elderly care, men's health, women's health, and also looking after children. And I'm very pleased to be here in this great clinic with a great team.
Brilliant. So what days, I think first things first, what days you're here treating at the clinic? Just so everybody knows.
So I suppose it's flexible. I'm local, so I'll always fit my patients in, especially if it's an emergency or if they're uncomfortable or in pain. But in general, I've got an operating clinic Mondays, Wednesdays and Fridays,
okay.
which is where really patients can either book in direct or book online.
Okay. And in terms of like what people can come and see you for, is it anything and everything, or is there, because it's private, is it different to going to see an NHS doctor?
Yeah. I suppose the difference is that we've got a lot more time. So we've got 30 minutes per consultation, so you can come with multiple problems. It's less rushed, and you've got complete follow-up with me, with my number, and you can message me and we keep in touch until you get better, which is quite a nice way to practice medicine. We offer everything that a normal GP surgery would offer and more. So we often do blood tests at the same time. I get results very rapidly. We offer travel vaccines, testosterone injections, hay fever injections. So it's quite an all singing, all dancing clinic.
Yeah, I think because I think there's been a few patients that have come in the door that potentially have been told by their NHS doctor that they would like to have a certain test but can't get that test from that doctor, so have come to see you for that particular test.
I suppose there are certain things that that I'm able to do, and certain things I'm less able to do in the NHS. And privately, we've got a bit more flexibility in terms of what tests we can do. But of course, ultimately, we always only do tests that are relevant, and I'm quite open and honest with my patients and talk them through what needs to be done and why I feel it needs to be done, and before just doing a barrage of tests.
Yeah, so if somebody came in to see you for a particular reason, would they expect to have that test done there and then in that consultation, or would they need to have a conversation with you first? Or
normally we can get pretty much every test that we would ever need to do in this environment, particularly blood test wise, through the laboratory, but I would have that discussion with the patient there and then, and if the test was warranted, we'd do it during the consultation to save time and just to make it a bit smoother and more convenient.
Okay, and how quickly can people expect results back from tests?
It's a really good question. I suppose, depends on the test. So the vast majority of baseline tests that we do, men's health, women's health, blood tests, we'd have back within 6 to 8 hours, and they'd be emailed directly across to you. Obviously, of course, you can always have a follow-up conversation with me if you want to go through things in a bit more detail. Other more complicated tests like COVID testing, which we're doing quite a lot of at the moment, it can take up to 48 hours to return to me. Antibody blood tests, again, take 6 to 8 hours.
Okay. And what about prescriptions? So if people need to get a repeat prescription, for example, or if you need to issue a new prescription, is that an easy process if they come see you?
Yeah, very easy process. I've set this up so that we can make this as efficient, friendly, and approachable as possible. Want to make this a convenient service for my patients. Initially, repeat prescriptions are issued after initial consultation, and they can be issued electronically, normally by email, to all the local pharmacies in Barnes who know me very well.
Okay, perfect. And what's the best way for people to book an appointment with you?
So probably the best way is to call reception
Yeah.
at the White Hart Clinic,
Yeah.
and we'll get that booked in my diary. Alternatively, you can book online, just like you would book with any of the other therapists at the White Hart Clinic, directly into my diary. But as I say, I'll always be flexible to try and fit those who need to be seen in on the day, whether it'll be late in the day or early in the morning, because I'm local, and I just think it works flexibly both for me and my patients.
Okay, perfect. Thank you.
Okay, thank you.
Thank you.